And our massage therapist, Howard, he hurt his knee, strained his knee. So he had 2 long buckets, buckets that, so most buckets are like that, and that's okay for feet. But he got a bucket that was probably like that. And what he did was he had it on the ground and he kneeled and he put his knee in the hot, then his knee in the cold, then his knee in the hot. It's probably maybe a bit deeper than that. And that's how he did his hot and colds. And then he did the castor oil compresses overnight. How do you know which compress to do? Try this one, see what the response is. Try another one, see what the response is. So you look at different poultices and you just look at different responses. And sometimes your body might like them all. Might like this for a while, then next time it might like that one for a while. But remember, the castor oil compresses, you can use that same one again and again and again. But using the alternating hot and colds in conjunction with the poultices, together they can be very powerful.
The conventional health advice you've followed your whole life could be entirely wrong. Dr. Barbara O'Neill, in her lectures, shatters some long-held myths and exposes a revolutionary approach to wellness that defies everything you thought you knew. So, this is more than just another video, because it's going to be a massive shift in understanding health and wellness in a way you have never seen before. For example, Dr. Barbara O'Neill emphasizes castor oil's unique ability to penetrate deeply into the tissues, a characteristic that distinguishes it from other oils. According to O'Neill, castor oil's effectiveness is attributed to its molecular structure, which allows it to permeate beyond the skin's surface and reach deeper tissues.
Castor oil compress. It can be used on the abdomen for constipation. It'll penetrate deep and break up congestion in there. It can help to break up gallstones in the gallbladder. It can help to revive the liver. So your liver, your gallbladder is under your right rib, so you would do it to that area. It applied to the kidneys, it can help break up kidney stones. And so there's a whole lot of areas that you can use castor oil. I don't advise you take it by mouth. It can be a little irritating there. I met a lady who was the wife of a doctor. She said, 20 years ago I had irritable bowel syndrome, and when my husband told me what he was offering medically, I said no thanks. And she'd heard about castor oil, so she applied castor oil compresses, and she said she healed herself. Little few dietary changes as well.
This deep penetration makes castor oil particularly effective in addressing internal issues such as lumps, adhesions, and bone spurs. The oil's ability to penetrate is largely due to its high ricinoleic acid content. Ricinoleic acid is known for its anti-inflammatory and analgesic properties, which enhance the oil's therapeutic effects. When applied topically, castor oil can travel through the skin layers and into the underlying tissues. This process can help to break down or dissolve localized fibrous tissues or scar tissue, such as lumps and adhesions, which might be contributing to pain or restricted movement.
The next thing I want to look at is castor oil, and I've got some good news. I'm not going to advise you drink it, but castor oil penetrates very deep, and it penetrates deeper than any other oil. So it can be used externally. And what it does, wherever castor oil penetrates, it breaks up lumps, bumps, congestions, adhesions. It can even break up a bone spur. It can break up tumours. I have known women have told me this, that's broken up lumps in the breast, and those lumps may be cysts or even breast cancer. Now, we had a doctor do our program, and she'd rung me up and she said to me, Barbara, can you help me? I've got a lump in my breast. It's 3 centimetres. I said, it's important that you go on the hormone balancing cream, buy some of those little panty liners, put castor oil on it, and just...
Moreover, O'Neill notes that castor oil's deep penetration can have significant implications for conditions involving bone spurs. Bone spurs are bony projections that form along the edges of bones, often leading to pain and discomfort. The oil's anti-inflammatory properties help reduce inflammation around the spurs, potentially alleviating associated pain. Its penetration ability allows it to reach and act on the affected areas more effectively than other topical treatments. Dr. O'Neill also suggests that castor oil's application as a compress can enhance its effectiveness. By applying heat over the castor oil-soaked cloth, the penetration is further increased. This method can amplify the oil's benefits by allowing it to better reach and influence deeper tissues and structures. But it's not only castor oil. According to Dr. Barbara O'Neill, onions, a common kitchen staple, have remarkable medicinal properties. In her detailed account, she shares a compelling personal story highlighting the effectiveness of cooked onions in treating her child's severe earache, achieving significant relief within just 2 hours.
I said, what did your mother do when you were a little girl and you had an earache? She said, Mum would steam up an onion on the stove. So I went home, I steamed the onion up on the stove, and then I cut it in half. So you keep the skin on and it keeps everything in place. The onion up in a cloth, a few layers. I tested it on my arm and I put it on his ear. You can keep it on for as long as you can keep it warm. James slept for 2 hours. When he woke up, he was happy. I watched him all day and the next day and the next day. That was it. Just compare my experience, 2 hours sleep with onion on his ear, and then my last experience with my first daughter, 6 weeks and 4 courses of antibiotics. And I have since learned that you can steam it and squeeze it. And if you squeeze it, you'll get a few drops of juice out. This is when it's hot, and it'll be boiling hot. But when the hot juice hits the spoon, it'll go a nice temperature, and you can put that in the ear.
This story shows how effective onions can be as medicine, especially when compared to how long it can take for regular antibiotics to work. Onions are rich in quercetin, a flavonoid renowned for its strong antioxidant and anti-inflammatory effects. Quercetin plays a crucial role in reducing inflammation and boosting the immune system. In the context of ear infections, inflammation is a primary issue, and quercetin's ability to mitigate this inflammation is pivotal. Additionally, onions contain sulfur compounds, including allicin, which are known for their antimicrobial properties. These compounds help fight off bacteria and viruses that contribute to infections, making onions a potent natural remedy. To harness these benefits, Dr. O'Neill recommends cooking the onions to activate their healing compounds. The process involves heating the onions until they become soft and their essential oils are released. Once cooked, the onions are placed inside a cloth or bandage and applied to the affected area, such as behind the ear. The application of warm, cooked onions not only delivers the beneficial compounds directly to the site of infection, but also provides soothing warmth that enhances blood flow. This increased circulation helps reduce pain and speed up the healing process.
I was put on strong antibiotics that made me so sick and it didn't really help. She said, so pneumonia's a pretty bad situation. So I said, come, we'll do what we can. We had a program on, so it was convenient. And I said to her, just a little tip on your way. She had a 5-hour drive. I said, cut up an onion, put half in one plastic bag, half in the other bag. Now, sorry, she didn't have to drive with the onion on her feet. Her boyfriend was driving. And I said, put your feet in those plastic bags and put a sock on. Well, she thought that was pretty strange, but she was willing to do anything. When she got to our health retreat, she was just smiling. She said, I'm in awe. She said, she said it lessened my tightness. She said it seemed to open my bronchioles. This is on the feet. Very simple treatment.
In contrast to the conventional treatment approach, which often involves antibiotics, O'Neill's experience points out a critical limitation. Antibiotics, while effective against bacterial infections, do not directly address the inflammation or discomfort associated with earaches. This can result in extended periods of pain and discomfort, despite the antibiotic's role in eliminating bacteria. Onions, on the other hand, provide a multifaceted approach by addressing both the infection and the associated symptoms more rapidly. Apart from onions, there's another common vegetable in your kitchen that has powerful healing properties you didn't know about. We are talking about potatoes.
So then the question is, why is the sweet potato low and the white potato high? The only way it can be determined is under a microscope. So under a microscope, the white potato has a loose fiber structure which quickly releases the glucose, but the sweet potato has a very tight structure, and the tight structure slowly releases the glucose. So one would question, why is a sweet cherry have the glycemic low and the banana high? Same thing. It has a lot to do with the starch structure.
Dr. Barbara O'Neill emphasizes the versatile healing properties of potatoes, particularly when used as poultices.
Which we'll move on to now is the potato. And the potato is probably the most famous and the most powerful for all tissue inflammation. Ginger is for joint inflammation, the potato is for tissue inflammation. So where you would use your potato would be a swollen ankle, sprained ankle, any area where you've got swelling, ingrown toenail. So to make the grated potato poultice, we grate the potato. Potato is very wet, so be careful not to make it too much. Spread it out a little. This is very cooling. And this potato poultice you can use in any of the tender parts of the body. Very good on sore eyes, very good for conjunctivitis, and you can see that's quite wet.
Grated potatoes have been employed in various therapeutic contexts due to their anti-inflammatory, antiseptic, and soothing effects. According to O'Neill, the starches in potatoes help to draw out toxins and reduce swelling, making them effective for treating a range of conditions. In her accounts, O'Neill details a dramatic case where grated potato poultices were used to address a potentially serious foot infection.
When I lived in the rainforest, there was a guy who lived on our property at the end of our paddock, you call it a field, in a caravan. He was a real hippie. And he was sickling the grass. You know what a sickle is? With bare feet. So what's going to happen next? The sickle went into the back of his ankle. Now I heard about it, but I didn't see him for a few days. And one of the guys said, have you seen Chris? His foot's up like a red balloon and there's a red line going up his leg. And he's lying in bed smoking marijuana, waiting for nature to heal. The body will heal if you give it the right conditions. And one of the problems with the marijuana, it was dulling the pain, but the pain was telling him to do something. So I said, we'll bring him up. So they brought him up, and the first thing I do, and Vanessa will show you this tomorrow night, I got 2 buckets of water, one hot, one ice cold, and I put his foot straight into the hot water. Now I had his foot in my hand and I was just watching his face. If it was too hot, I put a bit of cold in, because that first one can be, hard to take. 3 minutes. See, after 3 minutes, the blood slows down. So then you put it into the ice cold and everything moves up again, as Vanessa will explain to you. While it's in the cold, I put a little bit more hot water in the hot. And then so 30 seconds in the cold, after 30 seconds, things are slowing down, so you bring it back into the hot. So I did that 3 times, 3 hots and 3 colds. His pain had reduced by 50%. See, what that does is it brings fresh blood into the area, which drives old blood out, which gets the inflammation down somewhat. And then I made a very big grated potato poultice. You see, he had a wound that had healed on the outside and it had not healed on the inside. And tetanus happens in an area of a wound that hasn't healed from the inside and sealed on the outside, and there's an element of horse organism. Well, we had a horse in the paddock, so he was a perfect environment for tetanus. So I put a big grated potato poultice on his foot, and I said, come back in 2 hours. He could limp now. So just that reaction tells me we're getting results. When he came back after 2 hours, I took this off and the wound was oozing and the red line had gone down about 4 inches. Now, if he was still in pain and the red line hadn't gone down, we would take him straight to hospital. If in doubt, but we're an hour from hospital, so we could see results. And he did not want to go to hospital. So if he didn't want to go to hospital and we could see he was dying, we'd take him. Of course you do. So I did hot and colds again, and I did another grated potato, and I said, come back again at 6 o'clock, another few hours. And every time he came back, the line was going down. down, down, and the foot was going down, down, and the foot was still oozing. See, this draws. And when he took it out, you could see the area where it was drawing. And then he put the grated potato on. We put it on after another hot and cold all night. He came over in the morning, we did another hot and cold, and the red line was gone.
The infection, initially presenting with significant redness, swelling, and pain, was deemed critical by medical professionals. Conventional treatments were proving inadequate, so a potato poultice was applied. The poultice, made from freshly grated potatoes, was applied directly to the affected area and secured with a bandage. Over a series of applications, the poultice exhibited remarkable effects. The potato's natural enzymes and moisture worked to draw out the infection and soothe the inflamed tissue. O'Neill's use of the potato poultice is not limited to infections. She also suggests its application in cases of bruises, sprains, and minor burns. The poultice's effectiveness is attributed to the potato's ability to reduce pain and accelerate healing through its natural compounds. Potatoes contain compounds like catecholase, which have been shown to have anti-inflammatory properties. The cooling effect of the potato helps to ease discomfort and reduce redness in the affected areas. In addition to its use in treating infections and injuries, O'Neill describes the potato poultice as beneficial for soothing conditions such as eczema and psoriasis. The poultice's high moisture content helps to rehydrate the skin and alleviate itching and irritation. Overall, potato poultices are not only a versatile veggie for various dishes, but also have significant potential as a natural remedy. The next one is not a vegetable, but again, it's a common thing in everyone's kitchen. It's a spice called cayenne pepper. Dr. Barbara O'Neill highlights cayenne pepper's potential in supporting heart health through a compelling anecdote involving a heart attack. In her experience, cayenne pepper was utilized in a high-stakes situation where a person was undergoing a heart attack. Dr. O'Neill recounts that upon administering cayenne pepper, the patient experienced a notable improvement in their condition.
It shows how it does three main things internally in the blood. It thins the blood, it strengthens the arterial walls, and it opens the capillaries. So let me tell you about an experience I had a few years ago. It was one of our retreats. I got the call, lady'd had a heart attack. I was only 3 minutes away, that's why you have to be fit. I ran down, it was a cooking class with about 16 people, and she was lying on the floor. She was 80. Her husband said she'd already had a few that year, and they always called the ambulance, but they thought, let's see what they do. And I said to my offsider, cayenne pepper, quickly. We got the cayenne pepper. Now, there was a guy holding a pulse, and he said the pulse is almost gone. She was just white. So I don't know how much I got. You're just in a hurry. So I think I got about half a teaspoon, put it straight in her mouth. She was half conscious, gave her a little bit of water to drink. The guy holding the pulse yelled out, "The pulse is strong." This would have been 2 minutes. And you could feel that pulse come back, and all the blood came back to her face. She sat up and said, "What happened?" Everyone around was going.
This intervention is grounded in the active compound capsaicin, which is known for its vasodilatory effects. Capsaicin works by relaxing and expanding blood vessels, which can help lower blood pressure and improve circulation.
Cayenne pepper does not cause any bleeds. In fact, if cayenne pepper is going through your arteries and your veins and it finds any bleeding, it'll seal the bleeding blood vessel. How come it can thin the blood and yet seal bleeding blood vessels? Well, God said that He gave herbs for the service of man. So the cayenne pepper comes in and says, "Where would you like me? I'll thin this blood. Oops, I'll seal off that bleeding blood vessel." It's a powerful herb. The book Back to Eden by Jethro Kloss, he devotes half a page to every herb, and he devotes 10 pages to cayenne pepper. It's a powerful herb. Cayenne pepper not only thins the blood.
Research supports cayenne pepper's cardiovascular benefits, attributing these effects to its ability to enhance blood flow and reduce the risk of clot formation. Capsaicin influences the body's clotting factors, potentially reducing the likelihood of blood clots that can lead to heart attacks. Additionally, cayenne pepper has been shown to stimulate the release of beneficial nitric oxide, which also contributes to improved vascular health by dilating blood vessels. The pepper's ability to influence heart health extends beyond emergency scenarios. Regular consumption of cayenne pepper has been linked to long-term cardiovascular benefits. It can help manage cholesterol levels by decreasing low-density lipoprotein, LDL cholesterol, often referred to as bad cholesterol, and increasing high-density lipoprotein, HDL cholesterol, known as good cholesterol. This balance is crucial in preventing atherosclerosis, a condition characterized by the buildup of fatty deposits in arteries. Furthermore, cayenne pepper's thermogenic properties play a role in weight management, which is another crucial factor in heart health. By increasing the metabolic rate, cayenne pepper can help in reducing excess body weight, which in turn decreases the strain on the heart and reduces the risk of heart disease. The presence of antioxidants in cayenne pepper also contributes to reducing oxidative stress, a factor implicated in cardiovascular diseases. Next, we will talk about garlic. Dr. Barbara O'Neill, a prominent expert in natural health, highlights garlic's potent antibiotic properties and its effectiveness as a natural alternative to conventional antibiotics.
Garlic is a very potent antibiotic. In fact, the research is showing is 6 times more powerful than tetracycline, and that's a common antibiotic.
Garlic, Allium sativum, contains allicin, a sulfur compound responsible for its strong antimicrobial and antibacterial effects. Allicin is formed when garlic is crushed or chopped, activating its beneficial properties.
To use it as an antibiotic, you would need probably about 3 of those a day. Now, if someone says, my gut couldn't handle 3 of those a day, what you can do is you can get a bowl of hot soup, grate it into the soup, and that'll just take the edge off it if a person cannot handle it raw. Or something delicious to put into your baked potato is to grate this straight into, say on the fine grater, grate it straight into olive oil and then spoon that mix into your baked potato. Very, very nice. And some people choose to do the antibiotic sandwich, which is a slice of sourdough spelt toast, olive oil on that, and then grate this whole clove of garlic onto the slice, and then avocado and tomato. It is very delicious. It's almost like a little mini pizza, isn't it? And what happens is the bread underneath and the olive oil underneath, and then on top you've got the avocado and tomato. It calms it down a little bit.
Research supports that garlic can combat a range of pathogens, including bacteria, viruses, and fungi, making it a versatile tool in infection management. Allicin's effectiveness stems from its ability to inhibit bacterial cell wall synthesis and interfere with the replication of bacteria. This mechanism disrupts the growth and spread of bacteria, similar to how synthetic antibiotics function. Studies have shown that garlic can be particularly effective against gram-positive bacteria like Staphylococcus aureus and Streptococcus pneumonia. Additionally, garlic's antimicrobial activity extends to various fungi, such as Candida species, and certain viruses, including the common cold and influenza. Garlic's effectiveness is also evident in its role in enhancing the immune system. Regular consumption of garlic has been linked to increased production of immune cells, including macrophages and lymphocytes, which are crucial for fighting infections. Garlic also has anti-inflammatory properties that help reduce symptoms associated with infections, such as fever and swelling. Clinical trials have demonstrated that garlic supplements can reduce the severity and duration of common infections. For example, one study found that daily garlic supplementation led to a significant reduction in the incidence of the common cold. Another study observed that garlic extract could reduce the duration of symptoms in individuals suffering from acute respiratory infections.
One lady heard about garlic on the bottom of the foot and she grated it up, put on the baby's foot. Oh, she said, yes, I have a great big blister on the baby's foot now. But if you slice it like that, little by little, the garlic eases in through the pores on the bottom of the feet. And the garlic knows where to go. It'll go to the chest or it'll go to the sinus areas, and it can bring relief. It can even help to break up congestion in the chest. So my son James, when he was a little boy, he used to get a lot of chest colds. And I would put this on the bottom of his feet. He was about 2 and 3. And I'd put a sock on and I'd shoe on and I'd send him off to play. And every step he's taking, what's happening? The garlic's going into his body. You can smell the garlic on their breath within a few minutes. At the end of the day, when I'd take James' shoes and socks off and I'd undo the bandage, the garlic looked like a bit of dried out piece of yellow leather. no juice left. It's all gone into James.
Dr. O'Neill emphasizes that while garlic is not a replacement for antibiotics in all situations, it offers a valuable adjunctive approach to infection management. It is particularly useful for mild to moderate infections and as a preventative measure. Garlic's low risk of side effects compared to synthetic antibiotics makes it an attractive option for those seeking natural remedies. As we have covered both onion and garlic, how could we miss ginger? Dr. Barbara O'Neill highlights the significant therapeutic benefits of ginger poultices in alleviating joint pain and inflammation. According to her insights, ginger, particularly its active compound gingerol, plays a crucial role in reducing inflammation and discomfort in joints. Gingerol exhibits potent anti-inflammatory and antioxidant properties, which contribute to its effectiveness in managing arthritis and other inflammatory conditions. When applied topically, ginger poultices deliver these beneficial compounds directly to the affected area, allowing for targeted relief.
I would use a ginger poultice for an inflamed joint. So the easiest way to remember this is ginger is for joints. So that would be gout, it would be arthritis, also a sore back, an inflamed back. Now when someone's got an inflamed back, they usually put a hot water bottle on it, is that right? But if the back is hurting because of inflammation, where's my knife here? The hot water bottle will relax, and you know the reason why the hot water bottle relaxes is because when we're in pain, the muscles around that area tighten and cramp. Basically, they go out in sympathy with the pain, and you put a hot water bottle on that and it relaxes those cramping muscles, so you do get some relief, but it does not help the inflammation. It can even make it worse. But ginger, if you apply a ginger poultice anywhere where there's inflammation, the ginger pulls the inflammation out of the joint to the skin, and the skin gets really hot. So if you apply this to the lower back, the heat relaxes the muscles, and yet the ginger is reducing the inflammation.
The process involves crushing fresh ginger root into a paste and applying it to the painful joint. This method ensures that the active constituents in ginger penetrate the skin and interact with the underlying tissues, thereby reducing pain and swelling. Dr. O'Neill emphasizes the importance of using fresh ginger for the preparation of poultices to maximize the potency of the anti-inflammatory agents. Fresh ginger root contains higher concentrations of gingerol compared to dried forms, enhancing the poultice's effectiveness. For optimal results, she recommends applying the ginger poultice for about 20-30 minutes, several times a day, depending on the severity of the symptoms. The application of ginger poultices is supported by various studies that show significant reductions in markers of inflammation and pain relief. The mechanism through which ginger works involves the inhibition of inflammatory pathways and the modulation of immune responses, thereby mitigating the inflammatory processes that lead to joint pain. Moreover, Dr. O'Neill notes that the topical application of ginger is a safe and natural alternative to conventional anti-inflammatory medications. Unlike pharmaceutical treatments, ginger poultices generally have fewer side effects and can be used in conjunction with other therapeutic measures. However, she advises that individuals with sensitive skin or allergies to ginger should perform a patch test before full application. Incorporating ginger poultices into a broader regimen of joint care, including exercise and diet modifications, can further enhance joint health and overall well-being. Then, we have activated charcoal, which is renowned for its potent toxin-binding capabilities, a concept well articulated by Dr. Barbara O'Neill. This substance, also known as activated carbon, undergoes a specific treatment process that enhances its adsorption properties. Activated charcoal is produced by heating carbon-rich materials, such as coconut shells or wood, to very high temperatures in the presence of an activating agent like steam or phosphoric acid. This process creates an extensive network of pores within the charcoal, significantly increasing its surface area and adsorption potential. The porous surface of activated charcoal provides a vast area for interaction with various toxins. These toxins, including drugs, heavy metals, and chemical substances, are adsorbed onto the charcoal's surface through physical interactions rather than chemical reactions. This adsorption process is highly effective due to the charcoal's high surface area and the nature of the substances it can trap.
Charcoal is a remarkable substance because charcoal can absorb up to, I think it's the figures are about 150 times its own weight in poison. Now, charcoal is unique in that it not only absorbs poison, it neutralizes poison. That's a very important point. So you can use it internally for any poisoning, or you can use it internally for diarrhea. And a lot of people will travel with charcoal now when they go to Asia. You can actually get charcoal tablets. You can use charcoal externally for bee stings, wasp bites, spider bites, snake bites. But when you mix charcoal with water, it's like mixing dirt with water. So I'm going to mix it because I'm all for no mess, and charcoal's very messy.
Internally, activated charcoal is employed to address acute poisoning or overdoses. When ingested, it works by binding to toxins present in the gastrointestinal tract, thereby preventing their absorption into the bloodstream. The effectiveness of activated charcoal in such scenarios is influenced by the timing of ingestion relative to the toxin exposure. For optimal results, activated charcoal should be administered shortly after toxin ingestion. It is also used in cases of gastrointestinal distress, where it can help alleviate symptoms by adsorbing digestive irritants.
But where charcoal is unique, it will absorb and neutralize poisons. Nothing else will do that. And in hospitals today, they use charcoal for poisoning cases. One girl said to me, I had an overdose and they gave me a choice to have my stomach pumped out or take charcoal. She said, I chose the charcoal. So charcoal absorbs and neutralizes poisons. So it can be used internally and it can be used externally. Now, charcoal doesn't have a taste. And you can use it if any poison has been ingested. And it can also be used if a person has diarrhea or gastric or bloating. The charcoal, when it's taken, will absorb and neutralize the poisons and can bring a lot of relief.
Externally, activated charcoal is used in various topical applications. Dr. O'Neill discusses its role in wound care, where it can be applied to absorb toxins and bacteria from infected wounds. Its application in face masks is another common use, targeting impurities and pollutants from the skin. In these applications, activated charcoal's adsorption capacity helps draw out contaminants, promoting healing and skin detoxification. Its effectiveness is largely due to its large surface area and porous structure, which facilitate its role as a detoxifying agent in various health and wellness contexts. Dr. Barbara O'Neill highlights the potent benefits of alternating hot and cold water treatments, emphasizing their profound impact on enhancing circulation and mitigating inflammation. This method, often termed contrast hydrotherapy, operates on the principle of vasoconstriction and vasodilation. When applying hot water, blood vessels dilate, increasing blood flow to the affected area, and thereby enhancing the delivery of oxygen and nutrients, which promotes healing. Conversely, cold water induces vasoconstriction, reducing blood flow and limiting swelling and inflammation by decreasing the permeability of blood vessels. This alternating process stimulates the body's natural healing responses by creating a rhythmic contraction and expansion of blood vessels. The cyclical changes in temperature trigger a flushing effect, where the hot water opens the vessels and increases circulation, while the cold water constricts them, effectively pushing the stagnant blood and lymphatic fluid out of the tissues. This mechanism aids in the removal of metabolic waste products that accumulate during inflammation and supports the efficient delivery of white blood cells and nutrients essential for tissue repair. Dr. O'Neill also talks about the application of contrast hydrotherapy in managing chronic pain conditions such as arthritis and fibromyalgia. By consistently alternating between hot and cold treatments, individuals can experience a reduction in stiffness and discomfort. The increased blood flow from the hot water helps to relax muscles and alleviate pain, while the cold water application reduces inflammation and numbs the area, providing temporary relief from acute pain episodes.
Probably about 10 years ago when I was in New Zealand seeing a lady and she had her little son with her. And I noticed her son was standing like this with his finger like this, and the finger was twice the size. And I was looking at it, was all red with it was like a volcano, a pussy top. Now when a finger's that big, that's huge amount of pressure, that's pain. Remember, inflammation and swelling causes pain. And I said, what happened to the finger? And she said, it's cellulitis. That's what the doctor said. You know what cellulitis is? Inflammation of the cell. Oh, well, we can see that. But what happened? And she said, well, he had a blister there and the blister broke and he's playing in the dirt with his little matchbox cars. So what's happening now? You see, your skin is your protection. And when the dirt got into there, then immediately, it's incredible what the body does. It sends the SWAT team on, it sends the army there, swells it with lymphatic fluid to block it a little bit so it doesn't go through the whole body. The white blood cells come into. It's an amazing process. I said, what have you been doing? She said, well, he's on his second course of antibiotics. He's having painkillers a couple of times a day and sleeping tablets to sleep. Little 7-year-old boy. I said, can I try something? She said, please. So all I had to do was get 2 mugs. This is New Zealand, so you don't have to put ice in the water. It's cold. And he couldn't handle it very hot at first, and that's understandable. I got him to put his good finger in, so you've got to work with him. He could handle that, put the sore finger, okay, put a bit more cold in. Yeah, so you've got to win confidence. 3 minutes, then 30 seconds in the ice cold, and I poured a little bit more boiling water into the hot. Yes, he put his good finger in, and he said, okay, yeah. Put his sore finger on. I looked at him, I'm smiling. Yeah, I can handle it. I said, yes, good. And I saw the same thing with this young boy. When he went into the second cold, I saw his body relax. I saw a smile come to his face. By the time we'd finished the 3, 11 minutes, with him I saw easily 50% reduction in his pain. And this little boy, now he's just smiling. And I just grated about a teaspoon of potato, because that tissue swelling, if ever you see tissue swelling, you want potato. Potato will reduce that tissue swelling. Even though it was a joint, I knew that most of the swelling was in the tissue around. And I wrapped it on and asked God to bless the poultice. And for the rest of the interview, I was with the lady for about another half hour. This little boy just sat smiling. When they got home, about 2 o'clock, the little boy said, can we do that again? Now, why did that little boy say that? I'd like to suggest it's the first time that he's experienced relief in the 10 days since it first happened. So they did it 2 in the afternoon, they did it, took it off, and I think by the end of that second one, it was right down. And he had his shower, did another hot and cold, another bread of potato. She said that next morning when they took it off, everything came away. Everything came away. So now the finger's back to normal. So this is not even 24 hours. The finger's right back to normal, and he's got a little bit of a hole there. Well, you keep it covered. And, well, I'll just leave it with him. If it gets a bit sore again, what do you do? Another hot and colds. No amount of hot and colds and no amount of grated potato will open that once it's healed, and it totally healed.
Furthermore, this therapeutic approach is advantageous for enhancing recovery post-exercise. Athletes and active individuals benefit from improved circulation and reduced muscle soreness. The method aids in the prevention of delayed onset muscle soreness, DOMS, by flushing out lactic acid buildup. which is often responsible for post-exercise muscle stiffness. Dr. O'Neill recommends a practical approach to applying these treatments. Start with hot water for 3-4 minutes, followed by cold water for 1-2 minutes, and repeat the cycle 2-3 times. This regimen can be adjusted based on individual tolerance and the specific condition being treated. The duration and frequency of treatments should be tailored to the individual's needs and responses to the therapy. Overall, the strategic application of hot and cold water treatments leverages physiological responses to improve blood circulation, reduce inflammation, and enhance overall tissue health, offering a cost-effective and accessible method for both acute and chronic conditions. So, what was your biggest takeaway from today's discussion? Would you like to know more stuff like this? Because in the video I have told you a lot of things, but not everything. So, to know more, just click on this video where I shared 10 lesser-known anecdotes and examples based on the lectures by Dr. Barbara O'Neill that can change your life. Drop your thoughts in the comments below, and don't forget to like, share, and subscribe for more eye-opening content.